When was the last time that you thought about urination? Was it this morning when you woke up, or was it when you walked into the auditorium here and read the topic that you'll be listening to? Well, you may not realize it, but you can thank a small gland, a small location in your body, the hypothalamus, for how much you urinate. The hypothalamus, it produces a hormone called the antidiuretic hormone. This helps to regulate, among things, how much you pee and what goes in and out with that urine as well. All right, so medical professionals have said in the past that the average person will urinate somewhere between 4 to 10 times a day. Any more or less than this, depending on your specific situation, may cause you to seek medical attention immediately. Also, these same medical professionals also say that the preferred urine color is clear white or to straw yellow color. Anything darker than that, something like tea color, foul smelling, you should talk to your healthcare provider as soon as you can. All right. So in the event that the hypothalamus gets damaged through a tumor, cancer, surgery, medications that affect it, drug abuse, brain damage, trauma, too many sessions of boxing, or other illnesses, the hypothalamus can start to produce too much of this hormone on a regular basis, or it doesn't go down like it should, and this causes syndrome. This causes the hormone to become out of control and causes a syndrome of inappropriate antidiuretic hormone. So it may not seem like much, but it affects your life greatly. And for the average healthy person, you may not have to think about it because we're healthy, we're alive, and we're kicking. However, those with comorbidities already going on, they have to think about this even more. All right. So it may take a few days to a few weeks for clinical manifestations to appear, just because this syndrome does not, in and of itself, cause problems. What it does is it affects various systems and parts of your body, and when those come out of whack or out of their normal range, that's when the problems or manifestations appear. For example, uh, when you have high levels of antidiuretic hormone, when you have this syndrome, you're not peeing as much. You're retaining all that sodium, your potassium, your calciums, all of those toxins that your body normally kicks out. It's stuck in your body. Now with sodium, it's very common. Everyone has it. One of the manifestations, something that you can look for, is that they may be retaining a little bit more water in their legs, in their arms, in their face. The person may also experience some changes or different levels of consciousness. More drowsy, may have diarrhea, nausea, vomiting. They may have more headaches, more severe headaches if they already have them. They may have more issues with falling or standing up. They also have issues with seizures, epilepsy. If any of these occur, please talk to your healthcare provider as soon as possible. So now, that's just the sodium. You could also go in fact talk about many other various ions or parts of the body as well. How there's more fluid in your heart. The heart has to work harder to get the blood because there's much more water being retained in the blood, so your body has to pump it out harder through the body. Your lungs, your oxygen is not getting everywhere like it should be, like it needs to be, because there's more water, potentially some more in your lungs as well, retaining in your legs. The way to treat this depends on what's causing it. If there's a tumor or cancer, you may need to have chemotherapy or surgery to remove it to release that pressure from the hypothalamus. If it's a medication that's causing it, the healthcare provider can stop the medication or adjust it. If it's brain trauma, you've been playing boxing too much, they may seek alternative remedies or treatments. The way that the healthcare provider can detect this is doing blood work, doing diagnostic tests. At CBC, they need a sample of your blood to get it tested and compare it to what it was before, or compare it to the average person, and what those levels are being, how they're out of normal range. They will also test your urine. Because you're not peeing as much, it's going to be darker, more smelling, increases your risk for urinary tract infections or kidney stones. There are some medications that can help to treat this if alternative medications are not the cause. These medications can include Vaporsol. Now, like I said, it did take a few days to a few weeks for these clinical manifestations to appear, so it will also take a few days to a few weeks for all those clinical manifestations to go away and for that person to get better. Now, depending on the root cause of this, the person may or may not ultimately get better. It's unknown, and it's going to be continual treat and evaluate and plan cycle. Some complications from this, like I was saying, this affects the entire body, so your blood pressure is going to go up. That can affect your kidney function, your liver function, your vision. It can also affect your blood vessels. They may bulge up a little bit, depending on your medical conditions as well. You may also have to adjust your eating habits. Cut down on the sodiums, the preserved foods like Spam. Try not to eat as much of that if possible. And they will continue to do blood work just to make sure everything's returning down to normal range. Alright, hopefully this answered some of your questions. If you are a little bit more scared or nervous, try not to be. This is a rare case. Not everyone has this. You're more likely to get chickenpox than to develop this for the average healthy person. Alright, but contact your healthcare provider if any of these do occur, and have a good day.